You open a letter from the hospital. It says, Indeterminate pulmonary nodule found on your CT scan. Your GP tells you, don't worry, we will repeat the scan in 3 months. But you are not a doctor. So you do what most people do. You Google it. And suddenly your mind is racing. Is this cancer? Is it growing while I am waiting? Why 3 months? You start noticing every little cough. You lie awake at night wondering what's happening inside your lungs. I see this fear every single week in my clinic. I am Dr. Suman Paul, a respiratory consultant working in the NHS and in private practice. And in this video, I am going to walk you through the exact checklist lung specialists use to decide whether a lung nodule is something harmless or something that needs urgent action. By the end of this video, you will understand 5 key things. First, the size rule that tells us whether a nodule is very low risk or something that needs closer attention. Second, the shape difference between a harmless scar and a cancerous lung nodule, which radiologists look for on every CT scan. Third, the one word that can appear in your report that often means you can genuinely stop worrying. Fourth, why the NHS asks you to wait 3 months and why the wait is often medically the smartest thing to do. And fifth, what you can do if the anxiety of waiting feels unbearable, including how to get a specialist second opinion much faster. Before we start, I need to say this clearly. I'm a doctor, but I'm not your doctor. This video is for general education only, not personal medical advice. If you have severe symptoms like chest pain, coughing up of blood, or difficulty breathing at rest, call 999 immediately. Don't wait. Let's start with the first rule doctors look at: size. I like to show patients this with simple objects. Imagine a pea about 5 millimeters across. If your lung nodule is smaller than that, under about 4 millimeter, the chance of cancer is less than 1%. In fact, the British Thoracic Society guidelines say nodules under 5 millimeter often don't even need follow-up scans. Why? Because most of them are simply tiny scars left behind by old infections. Maybe you had a chest infection as a child, maybe a mild pneumonia years ago that you barely noticed. Your lungs remember these things. They leave tiny marks behind, almost like little tattoos in the tissue. And very often, that's exactly what we are seeing. Now compare that pea to something larger, about the size of a marble, roughly 10 millimeter. At that size, the risk starts to increase. When a nodule reaches around 8 to 10 millimeter, we use something called a risk prediction model. Think of it like a medical calculator. It considers your age, your smoking history, the exact shape of the nodule and the other factors. Then it estimates the probability that the nodule could be lung cancer. If that calculated risk is about 10%, we might arrange a PET CT scan. If the risk climbs above 70%, we start discussing getting a tissue, either through a biopsy or a surgery to remove the lung nodule. But here is the important thing. Size alone doesn't tell the whole story. A 12 millimeter nodule can still be completely benign, and occasionally a 7 millimeter nodule can be an early lung cancer. Which brings us to the second thing every lung specialist examines carefully: the shape. Imagine 2 spots on a CT scan. One is perfectly round and smooth like a marble. The other looks more like a starburst with jagged or spiky edges. Here is the key principle. Cancer tends to behave in a messy way. It invades nearby tissue and doesn't respect boundaries. Because of that, cancerous nodules often have irregular or spiculated edges. Benign nodules, on the other hand, tend to behave much more politely. They stay contained. They often look smooth, round, and well-defined. So if your radiology report says phrases like smooth margins or well circumscribed, that's usually reassuring. But if the report mentions words like spiculated, irregular, or lobulated, that's when we start paying closer attention. It doesn't automatically mean cancer, but it tells us we should investigate further, sometimes with a PET CT scan imaging or a biopsy. A simple way to remember it is this: smooth and round, usually something we can safely watch. Spiky or irregular, something we need to look at more carefully. But again, no single feature tells the full story. We always look at the complete picture. Now here is a detail many people overlook, and sometimes it's the most reassuring clue of all: calcification, which means calcium deposits in your lung. If your report says that the nodule is calcified, that's usually excellent news. Cancer almost never calcifies in these patterns. Calcification usually means the body has walled off an old infection or injury, essentially sealing it with calcium, like putting a protective shell around a scar. Radiologists even recognize specific patterns. Terms like popcorn calcification, laminated, or central calcification are classic signs of benign nodule. So if you see words like calcified nodule or benign calcification pattern, that's often a very reassuring finding. And here is an important myth to clear up. People sometimes assume that bright white areas on a scan must be bad. But in many cases, the whiter and denser the spot is, the more likely it's from simply calcium from a healed scar. Now, if the report says non-calcified or doesn't mention calcification at all, that doesn't mean it's lung cancer. It just means we evaluate the other factors like size, shape, and your personal risk. Why wait 3 months? When your doctor says, let's repeat the scan in 3 months, it can feel like nothing is being done. Some people worry it's just bureaucracy or cost-saving measure. But in reality, it's based on an important concept in medicine called doubling time. Cancer grows, scars don't. On a single CT scan, it's sometimes impossible to tell the difference between the two. But the time helps reveal the answer. If the nodule is simply an old scar, it will stay exactly the same size for months or even years. If it is cancer, it will usually grow, sometimes doubling in size over weeks or months. That's why the British Thoracic Society guidelines and many international guidelines recommend repeating the CT scan at about 3 months for many indeterminate lung nodules. If the nodule hasn't grown, the risk drops dramatically. If it has grown, that's when we move quickly with further tests. So when your doctor suggests waiting and rescanning, they are not ignoring the problem. They are using time as a diagnostic tool and avoiding unnecessary biopsies or surgeries for spots that are actually harmless scars. But let's be honest, waiting is difficult. And for some people, the anxiety during those 3 months can feel worse than the medical risk itself. And if you are losing sleep, checking your report again and again, or simply wanting a specialist to go through your scan in detail, there is another option. In my private clinic, I offer a second opinion service specifically for lung nodules. You can send your CT scan and report, and I will review it personally, explaining exactly what we see and giving you a clear risk assessment. Often patients simply need reassurance that the nodule is safe to monitor. Hearing that directly from a specialist can make a huge difference. In many cases, if the lung nodule truly needs urgent attention, we can arrange further imaging or referrals much faster in the private setting. A second opinion can be especially helpful if your lung nodule is larger than 8 mm, has irregular features, and if you have a history of smoking or previous cancer, or if the report itself feels unclear. You don't have to spend 3 months wondering what's happening. So let me leave you with the key takeaways. A lung nodule which is 5 mm or less usually carries less than 1% risk of lung cancer. A smooth round shape is reassuring. A calcified nodule is almost always benign. But a spiky shape or documented growth means we need to investigate further. Waiting for a repeat scan isn't neglect, it's evidence-based medicine. But you also don't have to sit through that waiting period feeling frightened or uncertain. If you would like a specialist to review your scan, explain your report clearly, and help you understand your personal risk, you can book a second opinion through the link in the description. Most lung nodules turn out to be harmless. In fact, the majority are simply old scars your lungs have carried quietly for years. And with the right information, you can make calm, informed decisions about what to do next. If this video helped clarify things for you, consider subscribing and watching the next video where I explain the 5 lung symptoms people should never ignore. I'm Dr. Suman Paul, and I'm here to help you breathe a little easier. See you in the next video.